It's been 8 years since the Monique strategy, a story that brought to the limelight the shortcomings of maternal health care in public hospitals in Cameroon. Today, a 15-minute documentary has been produced by the CRTV Policy Institute to raise awareness and advocate for maternal well-being in Cameroon. So joining us now is the technical lead of the CRTV Policy Institute, Epoh Severin, who has been at the forefront of this critical issue. Hello, Severin, and welcome to the program.
Thank you very much, Gladys.
So I would like for us to begin with the inspiration of this documentary. What is the raison d'etre? And also walk us through the information and testimony gathering process.
Thank you very much for this question. The raison d'etre of producing this documentary. First of all, we wanted to raise awareness regarding pregnant women health issue in Cameroon and maternal mortality. And secondly, seeing a pregnant woman lost her life during childbirth is a very painful situation. If you were to ask yourself the question or take the position of Monique, if Monique was your mother and you was one of the twins, so just imagine how painful the story of Monique was. So us using Monique story to produce a documentary is first of all to raise the awareness, and then secondly is, like I said in French, a devoir de mémoire. C'est un devoir de mémoire. So we wanted to remember ourselves, and then we wanted to remember the policy makers about what happened to Monique, why it happened, and what we can do for in the future, such a way that this case, Monique case, doesn't happen again. Because I am not sure that since Monique case happened, we still not have a few women passing away in hospital when they are going to give birth.
Myself, as a lady watching the documentary, I imagined myself in Monique's place, and it was really heartbreaking and painful.
Yeah.
So what kind of response or action do you intend to inspire with the release of this documentary?
It will be very dishonest for us to say that the government has done nothing. The government did a lot of work since. I just heard that there is a measure in the universal health coverage for pregnant women.
Yes, exactly. The universal health coverage also takes charge of pregnant women from the antenatal to delivery process, and the cost has been reduced to 6,000 francs. So yeah, the government has done a lot.
Yes, the costs have been reduced for 6,000 francs, but yet we are talking about public hospital, and there is many questions around this. What about the private hospital? What about the clinics? What about some of those hospitals in far reach in the country, in some villages? What about those pregnant women? And secondly, another issue that come up is how many women are aware that this measure exists actually? How many women? That is some of the questions that we need to ask ourselves. And then amongst the women aware, how many women are subscribing? So this is the kind of things that push us to make this documentary. We want the government to move from good to great and raise more awareness about it, because yesterday I just found out that there was a pregnant woman around me. She was not aware of that measure and she's pregnant. So I think that we need to raise more awareness.
So you intend with this documentary to increase awareness? To increase awareness. To educate more women about the available measures put in place for their well-being and that of their children? Exactly.
And then also to see how the private sector can be associated to this, because the government alone cannot take it all. That is a simple truth. The government cannot take it all. The government needs all of us to be involved in the process. So in that process, where is the part of the place of the private sector? And when you are talking about a private sector, we are talking about private hospital, we are talking about even private health insurance.
Okay, so are there any feedback so far since the release of Monique's memory by public or the healthcare professionals? Have you received any feedback?
Well, we have been receiving a lot of feedback. If you visit our Facebook page, for example, if you visit our YouTube channel, you will easily notice that there is a lot of engagement. The documentary just reactivated the conversation around the universal health coverage in Cameroon. It just reactivated the conversation around the state of our health care system. And actually, about 15,000 people already have seen our documentary. There is a lot of comment. If you go there, you will see that people are really interested, and then we receive also mails from people who watch the documentary.
Thank you so much, Epoh Severin, Technical Lead at the Carrefour Policy Institute, for your insights.
Thank you very much, Gladys.
So while drawing inspiration from Monique Kumatekel's memory to advocate continuous improvement in our health systems, it is important to also, or you as a woman, to enroll in the Universal Health Coverage Plan. Now, the Universal Health Coverage Plan in Cameroon that has been launched recently has been designed to reduce the financial burden of healthcare and promote equitable access to health services for all. Well, let's do this again another time, God willing.